Hi class, let's continue our discussion of digestive diseases with hepatitis. Hepatitis is categorized as a digestive disease because it infects the liver, and for lack of a better body system to categorize the liver, and we're going to put the liver in the digestive system. Hepatitis is an inflammatory disease that's marked by necrosis of the hepatocytes, so liver cells start to die. And there's going to be a mononuclear response that swells and disrupts the liver architecture. So we're going to have a lot of mononucleocytes responding in response to this disease, and this influx of that cell type, the monocytes, is going to cause the liver to expand and swell. One condition or symptom that's associated with hepatitis is jaundice. Jaundice is a yellowing of the skin. This is caused by excess bilirubin accumulation or buildup within our blood and body tissues. And this is associated with the liver not being able to filter it out of the bloodstream and put it into the bile so it can be expelled through the digestive tract. We found that hepatitis is caused by a variety of different viruses, not bacteria, but viruses. We have the cytomegalovirus, the Epstein-Barr virus, and the classic hepatitis viruses, A through E. There are some non-infectious conditions that have been known to cause hepatitis. These include autoimmune diseases, drug abuse, and alcohol abuse. Hepatitis is a disease that's marked by the liver cells dying off and the liver being swollen as those tissues are dying off. So, most people think of the hepatitis virus when they're thinking of hepatitis. Anything that can kill the liver and cause inflammation of the liver could be a cause of hepatitis. If we look at our hepatitis viruses, the most common causes of hepatitis, these are single-stranded, non-enveloped RNA-based viruses. So they contain their genetic information in a single strand of RNA. It is non-enveloped, which means there is no lipid coating on the outside of the capsid protein coat. These viruses can be transmitted through the fecal-oral route, and both cause relatively minor self-limiting forms of hepatitis for hepatitis A and hepatitis E. HEV, the hepatitis E virus, will infect pregnant women, causing approximately a 15 to 25% fatality rate in those ladies. These viruses have been associated with fatigue or flu-like symptoms in the subclinical stages, so when the stages are not strong enough to merit going into the clinic. If there's a more severe case or more noticeable case, that these symptoms include jaundice, the yellowing of the skin, and the swelling of the liver and tenderness of the liver. These viruses are not onconogenic, so these viruses do not trigger cells to become cancerous, thank goodness. In the vast majority of cases, if someone's infected with hepatitis A and hepatitis C, except for a pregnant woman, they are going to experience uncomplicated recovery. So the recovery is relatively straightforward and doesn't require extensive treatment. These viruses, hepatitis A and hepatitis C, can be transmitted by people who have bad personal hygiene or who lack the public health measures that are needed to help minimize the transfer. These viruses are transferred via the fecal-oral route, so washing hands after going to the bathroom is very important, particularly if you work in food or within food prep. Countries that have inadequate sewage control are going to have more aggressive outbreaks that are associated with fecally contaminated water and food supplies. Most infections result from unhygienic food handling, eating shellfish, particularly shellfish that have been exposed to untreated sewage, sexual transmission, or traveling to other countries. We have found that hepatitis A can occasionally be spread by blood or blood products. However, this is the exception rather than the rule. Most cases of hepatitis A being spread within the United States are going to be in that fecal-oral route transmission, not the blood-to-blood transmission route. In developing countries, though, we have found that children are most commonly the victims because their exposure occurs early on in life before their immune system is fully developed, before they have all that nice acquired immunity. Within North America and Europe, more cases are going to be appearing within adults. Generally speaking, this virus is not going to be carried chronically, so someone's going to receive the virus and then they're going to go through the stages of disease and then eliminate the virus from their body. The principal reserves for this virus are asymptomatic short-term carriers. I want to emphasize short-term carriers. There can be a carrier for a short period of time that doesn't have symptoms or that does have symptoms, but we don't have any typhoid Marys, so to speak, of hepatitis A and hepatitis C. We don't have any lifelong carriers that have been identified. Prevention of hepatitis A is based primarily on the hepatitis A immunization. This inactivated viral vaccine has been in use since the mid-1990s. This vaccine has a high success rate, and administration after exposure can also prevent symptoms. If somebody has been exposed to the virus but has not been vaccinated, we can give them short-term protection from the virus with some passive immunoglobulin therapy. This is helpful for people who have come into contact with hepatitis A virus-infected people. It also can be used for people who have eaten at restaurants that have had an outbreak but want to ensure that they do not contract the disease. Hepatitis B and D, though, are also going to be in this family of viruses that can cause inflammation of the liver. Unlike the hepatitis A and E viruses, which were non-enveloped single-stranded RNA-based viruses, hepatitis B is an enveloped DNA-based virus, and hepatitis D is an enveloped RNA-based virus. Hepatitis B is in the family Hepatidinaviridae. This virus is going to be known as a Dang particle. This is a term that is applied only to hepatitis B, to my knowledge. Hepatitis B is pathogenic when it has the surface S antigen expressed on it, and this antigen is responsible for a lot of the virulence of the virus. The genome of the hepatitis B virus is partly double-stranded and partly single-stranded. That's something that's rather unique about this viron, is that we have single-stranded DNA and double-stranded DNA making up the genome of this virus. If we look at our hepatitis D virus, it's that enveloped RNA-based virus. It's a subsatellite virus of the hepatitis B virus. So these two viruses are directly related to each other. This hepatitis D virus can only propagate in the presence of the hepatitis B virus. They need to work in conjunction with each other. Some signs and symptoms of Hep B, Hep D infection include direct damage to the liver cells. These liver cells are going to experience significant attack based on these viruses. Some of the symptoms associated with the attack on the liver cells include fever, chills, malaise, anorexia, and abdominal discomfort, diarrhea, and nausea. A lot of this anorexia is associated with a loss of appetite and an inability to absorb as many nutrients within the GI tract. Some of that is associated with the diarrhea that accompanies infection, and some of this is associated with the lack of bile production. That lack of bile production makes it more difficult to absorb lipids in the digestive tract. There are some rashes that can be associated with Hep B and Hep D, and arthritis-like symptoms as well. The hepatitis B infection can be serious, even life-threatening. This is an infection that should not be taken lightly. A small number of individuals can develop glomerular nephritis and arterial inflammation as well. Glomerular nephritis is going to be an inflammation of the kidneys, and then arterial inflammation is rather self-explanatory. Some of the blood vessels start to inflame. It is possible to have complete liver regeneration and restored function in the vast majority of patients. However, in a small number of patients, there's going to be a chronic liver disease that develops, and this will manifest itself as cirrhosis or necrosis of the liver. In some cases, chronic hepatitis B infection can also lead to liver cancer. So while hepatitis A and hepatitis E were not onconoviruses, hepatitis B is an onconovirus. It can lead to the development of cancerous cells in the human body. Individuals that have become infected as children are going to have a very high risk of developing a long-term infection. If we look at neonates or newborn children, 90% of infected babies at birth develop the chronic infection. If they make it to the ages of 1 without getting infected and then get infected at the age of 1, if they're infected at that toddler stage, there's approximately a 30% chance of them developing a lifelong chronic infection, and only 6% of individuals that are over the age of 5, when they are initially infected, will develop that chronic disease. This is one of the justifications of routine vaccination of children. If we can vaccinate these individuals while they're really young and keep them from developing the disease, they are much less likely to develop the disease in a chronic state. Individuals that are infected with hepatitis B and hepatitis D viruses are going to experience a more severe version of the disease and are much more likely to have that permanent liver damage develop in their bodies. The hepatitis B virus is going to enter the body through a break in the skin, through our mucous membranes, or through direct injection into the bloodstream. Not that I can imagine anybody would intentionally do that, but if we are sharing dirty needles with each other, then that could potentially occur. Once that viron reaches the liver cells, or the hepatocytes, it's going to start to multiply and release more virus particles into the bloodstream. This incubation period of multiplication and release is going to last between 4 and 24 weeks, with a 7-week average for most patients. The majority of individuals that are infected are going to exhibit a few overt symptoms initially, and then start to develop immunity to the hepatitis B virus particle. As we look at individuals that have been infected, this virus will multiply exclusively within the liver, and it's going to continue to deposit viron particles into the bloodstream. When we've looked at the bloodstream, we've found that there's relatively high concentrations of viron particles within the blood, with 10 to the 7th, so 10 million viron particles for every milliliter of infected blood. So even just a tiny little bit of blood is capable of transmitting this pathogen. Hepatitis B and hepatitis D are two big reasons why we want to have appropriate blood-borne pathogen handling, or blood handling protocols in place. This is one of the big reasons why you never want to touch blood from a patient directly. HPV has been detected in semen and vaginal secretions of infected patients and can be transmitted through those fluids as well. There's also vertical transmission possible as well. It can go from parent to child. So this vertical transmission will predispose the child to the development of a carrier state and increased risk of liver cancer, because generally speaking, this vertical transmission will occur very early on in the child's lifetime. When vertical transmission occurs, it is oftentimes referred to as serum hepatitis, because it's gone directly from the parent's bloodstream to the child's bloodstream. One of the major infectious concerns for healthcare workers is Hep B and Hep D. Needle sticks are very easily capable of transmitting this virus. Healthcare workers should have the full regimen of HBV vaccinations. Hepatitis B viron remains ineffective for days within dried blood, or months when stored in serum at a room temperature, or for decades when frozen. This is a very robust virus that's very difficult to deactivate. It's not going to be inactivated until it's had 4 hours of exposure at 60 degrees Celsius. So you need to pasteurize this virus for 4 hours to deactivate it. Disinfectant agents such as chlorine, iodine, and glutaraldehyde are also able to deactivate the hepatitis B virus quite readily. When trying to culture and diagnose this hepatitis B and hepatitis V viruses, we're typically going to use serological tests. These serological tests are either going to focus on detecting the antibody for the virus directly, or by detecting the viron antigens directly. Occasionally, radioimmunoassays and ELISA testings will permit early detection of the surface antigen of hepatitis V, so that we can have a more robust and early diagnosis. Whenever the antibody tests are available, those are typically going to be performed for patients who are negative for the antigen. So just because there's a negative test for the antigen doesn't mean that the patient does not have the virus present in their body. There should be a follow-up test by testing for the viron antibodies as well. Primarily, when we look at the hepatitis B virus, the best method is not to get infected in the first place. So the primary prevention mode is to get vaccinated so that you cannot become infected. Most widely used vaccines are recombinant-based vaccines. By recombinant-based vaccines, what we mean is that this vaccine has been genetically engineered or relies on genetically engineered microbes that secrete a couple of the antigens associated with hepatitis B, and then those antigens are purified and put into a vaccine to be injected. So we're injecting parts of the virus, not the entire virus, when we have that recombinant vaccine. Vaccination is a must for anybody who is going to be exposed to blood on a regular basis. So if you're a medical dental worker, absolutely get vaccinated. Individuals that are going to be in situations where you're exposed to lots of other humans in close quarters from wide varieties of life and wide geographic distributions, such as students or people who work with students like educators, should also be vaccinated. A patient that receives multiple transfusions of blood, any immunodeficient patients, and any cancer patients should also be vaccinated for this virus. This vaccine is now also being recommended for newborns as part of the routine immunization schedule. We back up a couple slides here. That's because if we can prevent that newborn from getting infected right away in life, they are much less likely to become a chronic carrier. The hepatitis A, hepatitis B combo vaccine is now found to be appropriate for some people as well, and it can reduce the amount of stress as we reduce the amount of needle sticks in that human's body. We can also have passive immunization for the hepatitis B virus. Passive immunization is going to be based on the hepatitis B immunoglobulin, HBIG. This treatment is going to give immediate protection for someone who's been exposed but may not potentially be immune to the virus, or may not potentially have an active vaccination regimen or current vaccination regimen. It's also going to be recommended for neonates that have been born to someone who is infected. So if mom has been infected, that newborn baby should also receive the passive immunoglobulin treatment for hepatitis B. Mild cases of hepatitis B viruses have been managed with symptomatic treatment and supportive care. But our chronic infections are going to need to have recombinant human interferon treatments. They can also be treated with some antiviral medications, such as tenofovir and entecavir. Sorry. Can you tell that I don't spend a lot of time reading brand names of drugs? Each of these antiviral vaccines can help stop viral multiplication, but not be effective in all patients. So it works in some patients, but not necessarily all patients. None of these drugs, though, are considered curative. So these are going to be symptomatic drugs. They help to reduce the amount of viral multiplication, but they do not eliminate viral multiplication. And then we also have hepatitis C. We're just continuing with the alphabet. So we've talked about Hep A, Hep E, Hep B, Hep D. Now let's talk about Hep C. Hepatitis C is sometimes referred to as the silent epidemic. There's approximately 4 million Americans that are currently infected with this virus, and it takes years to make noticeable symptoms or produce those notable symptoms in individuals. So you can be infected and transmitting this virus to many people and be completely unaware that you are a carrier and transmitter of this virus for years. Incidences of hepatitis C fell between the years 1992 and 2003, and no further decreases have been seen since that time, since 2003. One of the hallmarks of hepatitis C is liver failure, and it's one of the most common reasons for liver transplants within the United States. The hepatitis C virus is an RNA-based virus within the family Flaviviridae. The diagnosis of hepatitis C is going to be based off of a test of the blood for antibodies. So this is going to be a serological test to see if we are making antibodies for the virus. Signs and symptoms for hepatitis C infection are going to vary widely based off of how long the infection has been in the patient and how robust the patient's immune system is. It's going to have many characteristics in common with hepatitis B infection, but unlike hepatitis B, hepatitis C is much more likely to become chronic. Infected individuals are quite likely to become chronic. The majority of chronic infected individuals, 75 to 80%, will become a lifelong carrier, become infected indefinitely. It's possible to have severe infections without permanent liver damage with hepatitis C. More commonly, though, we're going to have chronic liver disease without those overt symptoms associated with the chronic liver disease. Hepatitis C is an onconovirus. It can result in the development of cancer. Worldwide, hepatitis B is the most common cause of liver cancer, and in the United States, liver cancer is more commonly caused by the hepatitis C virus. This virus can be acquired in a variety of ways that are similar to the hepatitis B virus being transmitted. So we can have blood contact. This can be either through blood transfusions or through IV drug use. We can also have some vertical transfer from parent to child as well. Occasionally we'll have blood transfusions, frequently blood transfusions were the primary cause of transfer before we had the blood test widely available. Hemophiliacs, individuals that needed to receive regular blood transfusions, were treated with clotting factor before 1985, had a very high infection rate of hepatitis C virus, because back in 1985, the blood that was donated was not tested for the hepatitis C virus. Once the blood began to be tested for the human immunodeficiency virus, HIV, and screened for non-A, non-B hepatitis, the risk of contracting hepatitis C was also reduced as well. Currently, there's no vaccine for hepatitis C, which is rather unfortunate. The current treatment regimen revolves around giving the patient ribavirin, pegylated interferon doses, and these treatments are non-curative, so these don't actually cure the patient per se, but they reduce the effects of the infection. They lessen the damage to the liver that the patient incurs. There are 2 new protease inhibitors that have been improved in 2001 to treat hepatitis C infections, and their efficacy still remains to be seen. I said 2001. I meant 2011 there. My bad. To summarize our hepatitis alphabet, we have hepatitis A and E. Those are the least virulent, least pathogenic ones. They have a fecal-oral route. We have hepatitis V for transmission. The hepatitis A and E can typically run the course, and we can have a vaccine and immunological treatments for hepatitis A and E. For hepatitis B, this virus has a very long latency period and is going to have an incubation period of 1 to 6 months. This virus infects quite a few people within the United States and has a vaccine available for it. Hepatitis C is the more dangerous of the hepatitis virons. It does not have a vaccine available, and there is no cure for this virus also. It's also worth emphasizing that Hep A, Hep E do not cause cancer, but Hep B and Hep C do cause cancer. If you have any questions for me about this presentation or the hepatitis viruses in general, please feel free to post them on the class discussion board or shoot me an email. Happy studies!